We are live.
All right, we are back. This is Senate Health and Welfare. And we're turning to H481, an act relating to public health initiatives to address death by suicide. We have looked at the bill previously, but Adam, do you want to come up and remind us of what is here in the bill?
Absolutely.
And then we'll try to go through and see if there are any changes we want to make with you and Katie. Okay,
Sounds good.
Thank you for being here.
Thank you for having me. Adam Washburn, student clinician with the Office of Legislative Counsel, here to do a quick overview of 481, an act relating to public health initiatives to address death by suicide. So we'll start in section 1, which establishes chapter 192, preventing death by suicide, and adds section 8151, which lays out the duties of the Director of Suicide Prevention. Duties include promoting and supporting statewide crisis and suicide prevention recommendations as outlined in the state suicide platform, including the creation of a strategic plan and a suicide prevention education protocol for all schools. The director shall expand partnerships, implement innovative data-driven initiatives, coordinating suicide prevention programs across the state, and work to secure federal funding. On to section 2. This is the strategic plan and school protocol. First, in section A1, the Director of Suicide Prevention will collaborate with the Agency of Human Services and stakeholders to develop a statewide strategic plan to suicide, pertaining to suicide prevention services, training, education, post-pension services, which shall be submitted to the House Committee on Health Care and the Senate Committee on Health and Welfare. The rest of this section lays out what the strategic plan should and shall identify. Subsection 2 of A, prior to the submission of the strategic plan pursuant to subdivision 1, the Director of Suicide Prevention shall submit quarterly progress updates on the development of the strategic plan to the policy committees between July 1st of 2023 and April 1st of 2024. In the January 2024 progress update, the director shall include preliminary budget recommendations and a sustainable funding plan for 988 Lifeline. Subsection B mandates that the Director of Suicide Prevention with the Agency of Education and stakeholders shall develop and submit a model protocol for all schools regarding the suicide prevention, education, and post-pension services, which shall be submitted to the policy committees.
Okay.
I don't have my computer with me. How many pages is this bill?
3.
Just
3. No, you're fine. Going on to section 3. This is the presentation, the Comprehensive Suicide Prevention Grant. Subsection A, the Department of Mental Health on or before February 1st, 2024, in collaboration with the Director of Suicide Prevention, shall present information to the House Committee on Health Care and the Senate Committee on Health and Welfare regarding the work accomplished by the state in accordance with the Center of Disease Control's Prevention's Comprehensive Suicide Prevention Grant, including the results of the Complete Suicide Data Linkage Project. Subsection B, prior to this presentation pursuant to subsection A, the department shall submit the results of the Complete Suicide Data Linkage Project to the policy committees as soon as they are available. And then section 4 is the effective date. This act shall take effect on July 1st of 2023.
Okay. So as you're going through, I'm thinking about a lot of different things here, but it does talk about a data-driven identification of those things that influence suicide for kids. And then there are some, we had a bill, let me just find the bill first, from last year. bill last year, the S-197, and it was related to mental health improvements for kids in schools and community in schools. And I'm wondering if we can, it did make it into law. Trying to find the act number, but it was S-197. And I'm wondering if we should relate the work here to some of the grants work that is going on right now between Department of Mental Health and Education and others. And that's a question maybe Katie you can help with.
Yeah, I'm taking a look at, it was Act 112, let me take a look at
Was
it.
it Act 112? Yeah, so I couldn't remember what it was.
Okay, Madam Chair, are we gonna get H230? That started in the Health Committee.
We'll have a chat about that later, right?
Okay.
It's a different conversation, but let's go to, it's not related.
Yeah, they're both about suicide, so.
Yeah. So let's go through the bill with an eye to markup and maybe adding and subtracting. You want to come up with that?
Sure.
Do that?
As I scanned through this Act 112, a lot of it was fiscal year 13 session law, or fiscal year 23 session law.
Yeah,
So it might not be,
but it does have trauma-informed
right, but it was time limited.
time-limited
So-
stuff.
I don't know if it's,
Because a lot of the funding was ESSER
It was
funding.
ESSER funding, right, it was ESSER 2. Was it ESSER 2 or 2?
Yeah.
ESSER 2, yeah. And,
Okay.
okay, so if we go through,
you want it up on the
Bill,
screen?
yeah, let's do that.
Okay.
And then the issue that Senator Gulick is interested in on social media. Hallelujah. It's interested on the effect of social media. There might be something we could put in here that would take us in that direction. That was one of the things I was thinking about. And then I know that mental health first aid has become very important, particularly in the after-school program. And I'm wondering if there's something we can link in with not just education generally, but the after-school program.
I think we did something on mental health first aid last year.
It
That
was,
was one
it
of
was
our
in,
bills.
it was in Act 112. It was in the bill that I was just referencing.
It was? I thought it was a
Yeah, let me-
different.
I don't know.
No, so.
So let's see, 112 had,
It didn't mention first aid, but the first aid folks became eligible. Sunny Mountain was in talking about the work that they do with kids, and then they've continued to do that work.
so you had a provision on mental health and well-being supports for educators, that was fiscal year 23.
Yeah, it's 500,000.
Then you had grants to expand mental health and well-being services to youth, also fiscal year 23. And that was providing grants to expand existing school-based counseling services, develop either school-based or community-based after-school programs operating in a variety of settings outside the school day over the summer, including before and after school and service vacation, to support mental health and wellness needs of students, families, and staff. So that was fiscal year 23. That was time limited. So that must be what you're thinking of. And then there are all different criteria for that. And then, you had an allocation of unexpended ESSER 3 funds, not ESSER 2, ESSER 3. And then you were asking for after-school task force reports. So that was what was in 112. Okay.
The question is, can we link it at all to any of the activities that took place as a result of that act? If at all, reference it.
So there's a report coming back and I'm wondering, let's see, on or before January 15th of 2025, the agency is to submit a report to various committees summarizing the programs to which grants were awarded recommending a model for integration of mental health and in-school, after-school programming that provides consistency and reliability. I'm wondering if we could ask the director of suicide prevention to reference that report.
Yeah.
So the director is submitting a report July 1, 24. And when did I say this other report was coming?
It's 2025.
Oh, darn, okay.
Yeah.
Yeah, okay, so that won't work.
Well, there should be some good data at that point around.
Yeah,
Social
so,
media.
I mean, it seems like there's a lot going on here that is what might be informed by the work that was going on 2023. So let's look at the language together and maybe it's something will
Okay,
come to us.
so I'll start with the director's duties. Department of Mental Health Director, Suicide Prevention shall lead the state's suicide prevention efforts, intervention supports, and post-vention efforts, and collaborate with communities and providers to reduce the number of suicide deaths and attempts in the state. The director shall promote and support statewide crisis and suicide prevention recommendations as outlined in the state suicide platform, including the creation of a strategic plan and suicide prevention education protocol for all schools. The director shall expand partnerships, implementing innovative data-driven initiatives, coordinate suicide prevention programs across the state, and work to secure federal funding.
So,
May I look at the-
go ahead.
I'm just curious in section 1, what's really new? Does this position already exist?
Mhm.
That's already his mandate?
What was the question? Does the position already exist?
So my understanding is, what does section 1 change? This position exists, the mandate's already, he already has a mandate for his job. I'm just curious,
I think it's the plan.
he already has his, he's already developing a strategic plan. That's part of this position. That's
Creation of a strategic plan. Right. So all of the director of suicide prevention, who is in the Department of Mental Health,
Right.
will bring folks together.
But he came in and spoke. I don't want to put too much pressure on him.
Education. Okay,
No, I thought he spoke here. Nick?
right.
Nicholas.
Yes.
Yeah.
Nick Nichols isn't the director.
He's not the
Not for
director.
mental health. They just hired somebody,
Yeah.
Chris something. He spoke up in healthcare. Do you have a witness list?
I do not. I'm just-
Okay.
Yeah, we should get Chris in. to do that. And Nick Nichols spoke on behalf of the Department of Health.
Okay.
It's really more of a generic question.
Yeah.
It doesn't seem to be creating anything new, except reports on grants that already exist. I'm just kind of wondering what we're accomplishing with this particular bill.
I'm not,
I asked that same question. We
Yeah,
went over
I
it.
know. I think the interest was in keeping things moving forward and maybe being able for us to add some information. We'll have Chris come in. Maybe we could get Chris to come in tomorrow.
What's his last name?
Is it Representative Simmons,
Oh, thank you.
Huh?
Siemens Bill? Didn't he come in and talk to us about
Bells
this?
and suspenders was Nick, I think. Nick said that. We could get Nick back in.
When we talked about this bill before, I asked that same question, Senator, because it seems like not
We don't.
it seems like not much, but I think we did get testimony, and I can't remember the name of the person who did it, but she was from, I think, the Northeast Kingdom
Yes.
Mental Health Agency. I can't remember. I just remember she was on the bottom right of the screen. And she talked about how this would help coordinate and sort of get, make sure that things were moving along and coordinate the programs across the state that are working on suicide prevention. She was fairly convincing, but I agree. It's sort of like a nothing bill that doesn't, it sort of is just reports on things that are already happening instead of doing
I was just
something.
wondering what I missed.
Okay,
Yeah,
so we had Chris Allen, Heather Boucher, and Nick Nichols from Department of Health, Super, and then Terry LaValle was the person that you were talking about.
That's who I was thinking. Yeah.
And I think it's important for a couple of reasons. One, as we go through, we might be able to add some improvements to the bill and relate it to the work that we've already seen happen with some of the grants work. And then to link it in with things like after-school program and to help build context for us in here so that when we come back, we know what's going on.
One thing that I think the data showed actually is that the age group most likely to die by suicide in Vermont is over 45 or something like that. It's older people.
So
White
Um,
dudes.
And yeah, and one thing that might be good to get some testimony in is from the Vermont National Guard. The Adjutant General is on a national suicide and domestic violence prevention task force for guards around the country. And he's done a lot of work on suicide prevention for guards members and also veterans. And it might be good to link this and have that integrated into this, in some of these reports, just to make sure that to the extent that connections are being made, they're included in it, because I think they're doing some good work with a population that is at particular risk.
So that is exactly what Nick Nichols reported on for the Governor's Challenge with the National Guard and the Department of Mental Health. And then looking at a goal of zero suicide. And then the planning process that's going on. So we can decide that the bill doesn't do anything, or we can work to put language in that will give our thoughts on that process.
Yeah, well, that's what I was suggesting, is that we
Well,
have
that's what,
language
and that's what's
specific to
in,
connecting with.
in that testimony. So,
It's not in the bill at this point.
well, that's, yeah, so we can add that into the bill. That's what I'm saying. Those are the linkages that we want to make. So if it's a link with the National Guard, or it's a link with after school, or the link with the work that happened in the grants for 2023, so that those things that have been or appear to be successful can be continued, so that there's a link with informed processes, data informed processes. So that's why we want to go through the bill and then think about how we can put whatever we want in to make it ours.
Do we give guidance to the director, or does the director give guidance to us? Because I'm thinking of things within our purview, like expanding the psychology compact to include social workers, for example. That the military came and spoke to us about that. You know, maybe eventually looking at psilocybin for PTSD prevention, things like that. Like who informs whom in this stuff? Does that
Good question.
okay? Or is it, maybe it's both, maybe it's a
Right,
forest.
Director of Suicide Prevention.
You sort of set the charge for the
Yeah.
person, and then if the charge is report back to us on certain topics and that.
And so it kind of brings people together. So
Okay,
if you look at Commissioner Boucher's testimony, the interim secretary now, testimony, and she says, thank you for this, because it helps Ed work with Director of Suicide Prevention and others if we put them in.
Okay.
So it's a coordination, it's a first step. And sometimes we see these bills as less important, but sometimes we learn a great deal as a result. I can't answer that question. So, right, so the question would be, does the Lifeline 988 extend into the National Guard environment?
So maybe something like the director shall expand partnerships, including with the National Guard and after-school programs.
Put that, yeah. Yeah. For service members and their families. Service members, veterans and their families, so that it's active personnel as well as others. veterans.
Where are you adding that?
The charge. And, sorry, I have hiccups. In section 1, the director shall expand partnerships, including with service members, veterans, and their families. Implementing innovative data-driven initiatives. Maybe I would break this out into a list, the director shall, and then I would list expand partnerships. Well, did you want to add after school there?
I'm
I
not
think-
sure, why are you focusing so much on after school?
That's
Instead
a
of in school?
significant, well, I think in school is here, and we can include in school, but it says for all schools, suicide prevention education protocol for all schools. But then after school is after school and frequently does not include, it also includes summertime. It does include summertime frequently.
Maybe that would be best in section.
I'm looking at the,
2.
which section, 2?
Well, I'm just thinking, so section 1 is the language that is retained in the green books. So like
Right.
broad things that set forth the charge that will be the charge of the director for suicide prevention moving forward.
Right.
Should sort of be in section 1. But section 2, this is more time limited. We're coming up with a plan within the next year, and what is this plan going to include? But I'm just thinking that this is where school and educational settings are, maybe a sentence somewhere to,
It says community schools, healthcare systems, post-vention services. It's
Where are you?
Page 2.
Line 9.
okay. First,
Data informed systems, that's what we do want that. And then social factors, and I questioned there, when I saw social factors, I knew that's social media. So is there something you want to add in there to get some preliminary information on social media?
Well, could we have something like paying close attention to data
Related
to children's screen time and or social media use? Or something like that? Maybe because it's,
why not?
they're just now starting to really compile the data.
Yeah,
So I think in the next couple of years, it'll be really
yeah,
interesting.
key, it will be, yeah. And by 2025, when we get the other report back, going full tilt.
okay, so it's the same thing like the plan shall address children's screen time use, screen time and social media use. And its impacts.
Why don't we say the effect of social media and screen time on
Children's
mental
mental health.
we don't need to know how many hours they're there, but there's research.
7
out there
hours
now.
a day.
Yeah.
That's what I heard yesterday, they're spending 7 hours a day.
And then we could add after-school programming on line 9, the
Okay.
same place we're in.
Does that fit?
Yeah, within community schools, after-school programs and healthcare systems.
Yeah. And this is a place to consolidate data and information so that any strategic planning that goes forward would be inclusive. I mean, it sounds, we feel like we're not doing anything, but in reality, we're giving direction for a more comprehensive look. I see David's very happy about this.
And now this could affect the education committee at some point as well, because anecdotally, what I hear is when
Yes.
kids aren't doing after-school activities, extracurriculars or sports, it's very isolating
Yes.
behavior
Yes.
on their phones.
Yes.
Which is not good.
So I'll add that sentence to A1.
Okay.
Okay.
You just
Okay.
read the sentence again.
Okay, so
That's you.
what did we do?
You just read the
Katie?
sentence again.
What we
Yeah.
did,
We're adding.
section 1 and section 2, what did we do? I didn't hear Ruth, what did you?
I just asked her to read it again. so-
Yeah, oh, good.
Who's on first?
So just to recap all the changes we've made at this point.
Okay,
In section 1, on lines 13 and 14, the director shall, and then we'll put a colon and have a list, expand partnerships, including this with service members, veterans, and their families. And then the other items will be listed out. In section 2, subdivision A1, on line 9, we'll have, and maintaining post-pension services with community schools, after-school programs, and healthcare systems. And then that would be followed by the plan shall address the effect of screen time and social media use on the mental health of youth, on youth mental health. I don't know.
I'm not, so I think we need to get data
I think-
before making the assumption in the bill.
Oh, I'm agreeing with you.
Yeah,
Yeah.
I'm not
I think what
comfortable
we
with that
want
either.
is to have them take into consideration any research and data related to, that's what we want
Mental
to
health
look at.
and just, because there are
Yeah.
lots of factors.
I don't know
and
if it can
calling
go-
that out, I don't think is.
Yeah.
I think that's, too,
Current research on
Let me see where-
items that affect children's or mental health, including use of
Okay.
social media, free time. something like that. We
so
just want to
Wait,
know what the data
Ruth,
is.
what's your hesitation with that?
because I think that the data is,
Nathan?
yeah, I think that by asking for it like that, you're making an assumption before understanding what the data is. And I think that, if there's gonna be information, we have taken no testimony on it. So I think if there's gonna be a
We wanna
request
know.
for information, I would make it more generic and not call that out any more than calling anything else out, because there are lots of factors that lead to
I get
suicide.
that, but
And
I think
True.
I've read articles, I think we're hearing from folks that there's something out there. So we would like to know what the research indicates about use of technology and social media.
What I heard yesterday was its linkage to depression and anxiety, not necessarily suicide. You could
Well,
argue that
what
the two-
leads to
you could,
suicide?
yeah, I mean, you could argue that the two lead there,
Yeah,
The plan shall include a mechanism for collecting data. Collection data
so you're hearing all of this.
on,
Yeah.
technology use by youth.
So I like,
Social
and I
media.
think social media is one application that's been influencing and is definitely out there.
Technology and social media use by youth.
Well, then, I mean, Ruth, to your point, if we're gonna name that, should we name other things like poverty and, I mean,
Right, and that's why I think that once you start naming them, you're prioritizing or making assumptions about what are the leading causes, and I think.
Well, no, you just say including social media. You don't have to say it is, but including the
I
possibility.
mean, I'm naming it only because it's a relatively new thing. And the data is, because it is new, it's very clear to make draw a line in the sand, pre-technology, post-technology, pre-social media, post-social media. And so that's where the power of the data is coming out now. Do you know what I'm saying? Like, poverty's been around forever and drug use has been around forever, but this is in the span of time. It's
Trauma and
new.
Yeah, I mean, whatever, I think this, this is not a hill I'm gonna die on, but I think that it's making assumptions that we don't have the data to support right now. And so, and also by calling it out, we're excluding other things. And so it seems like one of those things that a lot of people like to feeding frenzy on, oh, this is the reason. I mean, we've also have
I don't,
increasing economic inequality. We have had a pandemic. We have a massive increase in the number of guns in our country. We have, a ton of other, factors that contribute to it. And I think calling that out would ignore the other factors that are, or would seem to ignore the other factors that are equally as
So I'm looking at the phrase including social factors. So social factors, the implication is, could be isolation. We know that the pandemic has had its effect.
What line is that?
On line 7 on page 2.
Oh, yeah, yeah, yeah.
Okay. So it says including social factors. I'm not making any assumptions about social media. It could be very helpful, beneficial. That's kind of helpful to be helpful. But
Is social media a social factor?
improved data collection.
I mean, I think of social factors as what you were saying, poverty. You know, all those other things.
Yeah, I don't know. I mean,
I'm gonna look at one of the pieces of information that we received from in our testimony.
Sounds like you're moving away from this concept. In case you're not, the sentence I have is, the plan shall include a mechanism for enhancing data collection, including on technology and social media use by youth.
And we don't want them to collect data on the use itself. We want to know
oh,
if there's a research base for,
Okay.
if there's a research base for the social factors. We want to know if there's a research base. for
how
any
about
of what they're
something
doing.
like,
It's data.
On the link.
including, sorry, moving on to looking at another bill, but,
Emerging research.
on factors that contribute to.
Yes, emerging research
That's
on
good.
factors that
That's-
contribute to.
Yeah, that's good.
Okay,
Factors.
then they have to do a lit review and find it.
Contributing to youth death by suicide or to
To suicide prevention, suicide.
suicide. Okay. So the plan.
Okay, we finally got there somewhere.
Plan to consider emerging research on factors contributing to suicide.
Emerging factors.
Emerging factors, I have that. I just
Oh,
didn't
you
say
did,
it.
okay.
I do have it.
Yeah.
Okay,
Okay, what's next? Where that was page.
we're on page 2.
Good thing it's only 3 pages long.
Then you have language about, sort of updates, quarterly updates on, until the strategic plan is adopted. What is what's happening with the plan? So section B, you have, language that the director of suicide prevention with AOE and others should develop a model protocol for schools regarding suicide prevention, education, and postvention services that is delivered to the policy committees.
Do we want to mention anything here about any relationship to what we've done previously? Did we mention that earlier, like the Act 112 or the after school? I know we said after school earlier. Did we put the Act 112 work in there or not?
We have not. Okay, let me think about that.
Because they had a community-based grants that went out to everyone from primary care providers to parents and.
That would probably be the place to add it. Let's see. Director and coordination shall develop a model. Let's see, do we have data on this? Yeah, we just don't get the. You just don't get a report until after this one is due. We could say something like, so I'm in subsection B.
Preliminary results from?
Yeah,
Yeah,
considering, taking into consideration. Okay. Shall develop and submit a protocol for all schools the model protocol. The model protocol. Protocol shall reflect preliminary data. Data. Related to grants pursuant to this section, related to grants.
I mean, what happens to us is we do one thing one year, we do another thing another year, and then we never know what's going on next year. So having this person pull all of this data together will be helpful, even though it's feels so slow and frustrating.
Okay. So the model protocol shall reflect preliminary data related to grants to expand mental health and well-being services to youth pursuant to Act 112.
Cool.
Okay.
Of what year?
Yeah, I have the full section. That was my shorthand.
2022.
So you
Okay.
didn't have all the details.
Okay, we're good. All right, with that,
Okay.
is that sufficient? Does anyone have any other brilliant suggestions? Do we want to list firearms and? Okay,
I mean, that's in another bill though, right?
It is. Well, I think this is a good start. And I know that the House started with a much different bill, and then I think on this one, they whittled it down for a bit, didn't they?
I did a walkthrough of
Yeah.
language on the a suicide fatality review team, like the child fatality review team.
Yeah.
That's sort of where this started.
Difficult. This is difficult. Okay, are we good? Is there anything in here that asks the Director of Suicide Prevention to reach out? They're reaching out to various groups, so it'd be like NAMI would be involved.
Well, I mean, the charge of that director is to expand partnerships, so
Okay,
presumably that could be
okay,
families or
all
anyone.
right, we'll leave it at that.
Okay.
We don't need a such as.
Okay.
Anybody else? Are we good, committee, with this? Where we
Yeah.
are at this point?
Thank you.
So is there a way that we could look at this perhaps tomorrow or Friday? I think we'll have time to go
Oh.
through it.
Yes, I mean, am I available? I don't know, but I can have the language to you. I mean,
That would be good.
I already have your colors locked up extra for 94.
Oh, perfect.
Friday.
There we go.
Perfect. Okay. All right.
We're
good.
ready to
So
go. Thank you.
We'll put
I thought
this,
we might be.
we'll put this up on Friday.
Okay, great.
In the meantime, we'll be pondering on it, I'm sure, over time. Good. Thank you. And thank you, Adam. Helpful. Okay, anything else, committee? No. Okay, we've got our bills set for tomorrow. We're gonna go back to H 171, which is the bill on adult protective services. And we've had some communications from different folks. And Katie will be bringing in the proposal amendment that we've been looking at together in committee. And then we'll also be looking at the unused drug repository. We'll have folks in to help us follow up with that. We're good. Thank you.
You're welcome.
Oh, that's it. We're gonna call it a wrap.